If you bring 5 orthodontists into a room, talk about early treatment, you're going to get 5 different opinions. As long as I could remember, it's been a debate in the profession, and as of late, phase 1 treatment with aligners are becoming more popular. So, is it worth the extra time and expense? Stay tuned. Our Golden Age of Orthodontics podcast sponsors make it possible for us to bring you new episodes. Cale Owen is revolutionizing orthodontics by turning the chaos of conventional braces into custom control. Their custom digital solution helps you achieve consistent results while saving on average over 7 appointments per patient. It's custom done right, so you can focus on delivering amazing smiles. Find out how Cale Owen can modernize your practice. Book a demo today and get $250 off when you mention People in Practice to your representative. Created by an orthodontist, Grin is redefining remote monitoring with a cost-effective solution that boosts practice efficiency while delivering personalized care for each patient. Grin provides you with dedicated assistance, enabling you to focus on providing exceptional care, all while saving valuable time for you and your patients. New customers can save up to 35% on their starter package. Transform your practice. Better care begins with Grin. To find out more about our podcast sponsors, visit pplpractice.com/partners.
The future of orthodontics is evolving and changing every day. But although the way to achieve practice growth has changed, there's never been a better time to be an orthodontist. Let's get into the minds of industry leaders, forward-thinking orthodontists, and technology insiders to learn how they see the future of the orthodontic specialty. How will digital orthodontics, artificial intelligence, clear aligner therapy, remote monitoring, in-house printing, and other innovations change the way you practice? Join your hosts Dr. Leon Klempner and Amy Epstein each month as they bring you insights, tips, and guest interviews focused on helping you capitalize on the opportunities for practice growth. And now, welcome to the Golden Age of Orthodontics with the co-founders of People in Practice, Dr. Leon Klempner and Amy Epstein.
Welcome to the Golden Age of Orthodontics. If you don't already know me, I am Leon Klempner, a retired board-certified orthodontist, director of ortho at Mount Sinai Hospital, part-time faculty at Harvard in Montefiore, and the CEO of People in Practice. I practiced for about 40 years before co-founding People in Practice Marketing with my partner, with my daughter, and with my podcast host, Amy Epstein. How you doing, Amy?
Person. I'm good.
All the same. It's three different people.
Three different people, yeah. All wrapped up in one. I'm good. I'm Amy Epstein, and I'm the other half of the founders of People in Practice, and we do this show together. And our work here is to bring thought leaders to our audience of orthodontists, people who are at the forefront of their field, people who can help other practices to grow or to see things in a different way. And that's what we hope to do today.
And, before we jump into our interview, I want to just give a quick shout out to our sister podcast, Practice Talk. It's hosted by our very own Lacey Ellis, one of our senior growth consultants here at People in Practice. So Lacey brings decades of real-world experience in every episode. It's really useful for staff. So I would highly recommend subscribing, and you get a lot out of it.
Yeah. And she's extremely experienced in both on the clinical side. She's worked in orthodontic practices in almost every role. She has worked at other consultancies. She's been with People in Practice for a number of years as well. So she's incredibly knowledgeable and very and a trustworthy voice because of all of her experience, both within the practice and outside of it.
So, Amy, let me let listeners in a little bit on our personal lives, because we're going to talk about early treatment. And I wear a hat as a grandpa. Amy wears a hat as a mom. So one day, Amy says to me, "Grandpa, take a look at Kayla. my 7-year-old granddaughter.
By the way, he's
There's no,
constantly like pulling down lower lips and looking at crowded lowers of all the grandkids. Every once in a while he just walks up to a kid and has a look. All right, bite. Okay, open. Okay, bite again. Anyway.
but you really identified this. You said to me, "There's no room for these teeth to come in." That she's having a hard time cleaning it. This
Yeah,
stuff,
hygiene's
gunk
a
build
you
up.
can see the buildup and, no amount of flossing can get to these little spots. And anyway.
Well, anyway, so I said, okay, let's get a consult. And I recommended my friend Barry Glazer, and now Kayla's wearing aligners. So, how is our 7-year-old granddaughter doing with her aligners?
I was unsure at first. She's actually a pretty organized kid. So, if we were talking about my older, I would have had some more reservations, but um actually she's doing really well. And she goes from a liner to a liner pretty quickly. I was surprised for 4 days or so. And so there's a bit of like progression, gamification going on there that makes she's sort of like checking boxes that she's moving on. And well, I mean, it's only been a couple of months, and there's more room. I mean, hygiene is already better, so that's great. Um, and actually, Dr. Glazer is he's close, but not that close. But with the remote monitoring tool, it makes it a little bit easier to be able to, um, you know, go see him, and of course him, which makes things great, very comfortable for us and Kayla, that this orthodontist is friends with Grandpa. Um, but anyway, yeah, she's just a long story short, she's doing really well. She wears it when she's supposed to wear it. She takes it out when she's supposed to take it out, and she's really good about putting it in the bath in the evenings and in the mornings to get it clean, as we say. It gets left here and there sometimes, but for the most part, she's doing really well. She only just turned 7, so she's kind of little. But yeah, it's so far so good, and it's really fixing the problems
Hmm.
that we were wanting to go after. So anyway.
I did a lot of early treatment when I was in practice, and I'd much rather have a 7 or 8-year-old in terms of compliance than a 13 and a 14-year-old wearing rubber bands. I mean,
Mhm,
that is like banging your head against the wall. The
mhm.
young kids to me were the most compliant in my practice. So, and Kayla's perfect. She's got the personality. I see her cleaning the stuff and soaking it and things like that. So, in my day, it was acrylic appliances. It was, brackets sometimes, headgear. This is a whole
Oh, I
new
remember the
game.
headgear.
Yeah,
I
well,
remember that headgear. Didn't like that headgear.
yeah. Well,
Anyway,
you don't have an overbite anymore, do you?
this is the truth.
Okay.
This is the truth. Anyway, so clearly, at least in our life, aligners have changed the game for us, allowing Kayla to get some of that space that she needs. And I imagine it's changing the game for other little patients too. So we've got the perfect guest to talk about this topic. Dr. Don Spillers is a board certified orthodontist, he's an educator, and he's a leading voice in early aligner therapy. He's the founder of Spillers Orthodontics in Warner Robins and Macon, Georgia. He has built his practice around innovation as its mission, digital workflow, and an aligner first approach to phase 1 treatment. He's a faculty member with Align Technology, and Dr. Spillers teaches orthodontists around the country how to successfully implement Invisalign First. He is passionate about clinical excellence, team education, and advancing the future of orthodontics through thoughtful, tech forward care. Dr. Spillers, Don, if that's okay, it's wonderful to have you here. Thank you for joining us.
Hey, good morning. Glad to be here. Thank you for the invitation to talk about something that I am very passionate about.
So, Don, you heard, I do a lot of teaching. I know you do a lot of teaching. So, tell the audience a little bit about, how you got started with Align and what pulled you into the educational side of the profession.
Yeah, so I guess it's probably been almost 9 years ago now, one of my reps came by and said, "Hey, can we go to lunch?" And I was like, "Sure." And so the lunch was set up to talk about what we were doing with aligners. The company had seen what we were doing, and he's like, "You're really doing some stuff that not a lot of people are doing at this point. You're doing surgery cases, you're doing impacted canine cases, you're doing extraction cases, and you got to roll back 9 years ago, and there was a lot of talk about aligners don't work and you can't finish cases and all those things. And so I was just doing my thing and learning how to use this tool. It's no different than, I would say, switching to a different bracket system. You got to get yourself back up to what that you're doing with those different type of appliances. And so I had never really thought about teaching other doctors how to do Invisalign. I was focused on what I was doing and my learning curve, because I'm like you, Leon. This was nothing digital 32 years ago when I was in orthodontic school. This was nothing like what we're doing today. And so I said, sure, I would do that. And so we set up a study club, and I went to Atlanta and gave a talk, and really, enjoyed it. I've always enjoyed teaching. I love teaching my staff. I always tell them, we're lucky that we're getting to change people's lives, and you guys are changing people's lives. And I don't like my staff I always tell them, you're not a robot. You're not just tying and untying wires, or you're not just seating aligners, or, I want you to understand why we do what we do. And so I've always enjoyed, sharing and teaching my staff. And so now I've been very lucky to really travel all over the world and speak, from Dubai to Spain to, I mean, all over the world. And so, and all over the United States. And the topics range from first that we'll talk about today, Invisalign First with some of these growing kids, to complex cases. So it's just really been, it's been very gratifying, and honestly, it's been very exciting for me at a point in my career where a lot of people may be winding down. I'm winding up, and very involved with a lot of things that are happening with behind the scenes with the line, and been very fortunate to test a lot of the things that we'll talk about today, and before anyone else even got to see them, right? And so it's just amazing, the field of orthodontics. I think we're on the verge of some really big changes that are coming, and it's a digital world, and it's all you hear about every day, right? Is all the stuff that's digital, and I felt like for a long time orthodontics, we fought that. I was one of those guys, right? I mean, you can talk to a line and tell. I literally told them, don't ever come back to my practice. I don't want to see you. Your stuff doesn't work, right? And now here I am teaching this because I was unwilling to learn at that point. I only knew what I had been taught previously, and so and I know that we're going to be setting some new precedents on some things, and a lot of the data that we have is based on 40, 50, 60 years ago. And I can just tell you clinically, a lot of the things that we're seeing, especially in these growing kids, is not what I was taught, right?
Yeah.
And so it's just been really exciting to teach this and share this with other people. And I also teach at UAB in Birmingham at the orthodontic department there. Me and my son teach there. We're there every 6 weeks, and that's been really amazing too, because we can be there and cover clinic, but yet we can also use Zoom and talk about cases and go over cases. So again, that's the digital world, right? And
So Don, let me interrupt just for a second, because I know Amy was asking me, some business related questions. So what
Yeah.
was on your mind, Amy?
So, I my question for you has, so as not as an orthodontist,
Okay.
And so not as a clinician. My questions come from the dual vantage points of being a business owner and being a mother. So
Right.
let me ask you this question in two ways. So as a business owner, what has the impact been of implementing a significant amount of phase 1 aligner therapy in your practice? That's the first bit. And then if you don't mind also addressing so more like efficiency and clinical outcomes and things like that, but then also in terms of the patient experience. So as a mother of a 7-year-old who's in treatment, like how has that impacted your how do you think that it's impacting the patient experience?
Well, absolutely. I know it's impacting the patient experience in a very positive way. Um, think about what we did in the past. Me and Leon, we were fitting bands on molars. We were putting lip bumpers in. We were doing headgear. We were doing rapid palatal expanders, which all that works, right? We're not saying that it doesn't. I always tell my patients the telephone that hangs on the wall with a cord, it works also, right? But we have something better. And so with these growing patients, honestly, in the very beginning, I was very hesitant to treat these young kids. And I always found it very interesting why we as a profession say, hey, make sure you visit your orthodontist at 7, right? And then we would see them, and sometimes we'd put an RPE in, do those kinds of things. But most of the time we just watch them grow and watch them get more crowded. And then we, would extract primary teeth and then, set them up to extract permanent teeth later. And so I can tell you 100%, if we can get these kids while they're growing, the majority of the time, we do not have to take teeth, even primary teeth. We want to use them. So that's been a big change in our practice, because I was the guy, if you came and you were crowded, you were going to get primary teeth extracted for sure. And so that's been a big change. And for the patients, think about it. I mean, if you have a 7-year-old, all you have to do is scan. And now we have the new scanners with Illumina. Literally in a minute and a half, we can have a digital set of models that we can work off of. So the hardest thing that we have to do for these kids is scan them. Honestly, it's the hardest thing that we have to do for them. So it's very easy on their end. It's fun. They get to play with their teeth on the screen. And so it's totally 180 degrees from fitting bands on teeth and, cementing an expander in. And truly, it's less responsibility for the kids. I know we all get hung up on they're not going to wear them. These are your best patients, for sure.
Yeah, she's definitely wearing hers 22 hours during the day. She eats lunch and she eats dinner. And
what
otherwise she's looking for it. She was she wants to know her case is nearby, and it's part of her very few responsibilities that she takes care of on her own. She's pretty proud of it.
Yes.
And she wants to deliver.
And most of them will remind you that it's time to change. We hear that from parents all the time.
Yeah.
But the exciting thing for me is that they're not in any pain. It doesn't hurt. It doesn't change their life. They can take them out. They can eat whatever they want.
Play
There's
sports,
no restrictions. They can clean better. So less decalcification than when we were placing brackets on a 2x4 and all those things. So less gum tissue problems. It's just amazing. And
from a business perspective, Don, what have you seen that has changed? And remind me when you really ramped up, and from that point, what you've seen.
Yeah. So once we really ramped up as far as treating early treatment, we started sharing a lot of these cases with our referring doctors and showing them, hey, look at the bone change, because one of the things that we do that I think makes a huge difference for the parents is every patient that comes in, we have the ClinCheck on a second monitor on the chair. And we do a comparison of where the patient started and where they are 6, 8 months down the road, whatever aligner they're wearing that day. And what's unique about that is you can actually see the arch shaping. You can see the change in the arch. You can see the space being created. And parents can't see that in the mouth. They just see the front teeth getting straighter.
Right.
And so same with the dentist. When we show them, our referring doctors, hey, look what we're doing. And the reality came to me one time when I thought, well, these kids aren't going to wear them. And people are saying, well, you can't really change their bone, all these things. And I thought, well, I don't know if I buy that, because I see these kids come in, they've been sucking their thumb for, 2 or 3 years. And what have they done? They've changed their bone. They have an anterior open bite. They have a posterior cross bite that they created by creating suction. So that's pushing inward on the upper jaw. If I have something that I can push outward, which we can with an expander, but the aligners also do that. And that's what's unique. We have them on the inside, we have them on the outside, on the occlusal. And so we can actually shape that bone. And as that kid is growing, we only get space two ways. And Leon is on board with that, I'm sure. Every orthodontist. You either change the bone or you pull teeth. You got to have space. And if you need a lot of space, those are the two big ways that you're going to do it. And so that's what we've seen in our practices grown. Our early treatment was about 30% of our practice now.
So Don,
that's
you
big.
mentioned something earlier, if I could just interrupt you for a second, that stuck with me. And, when I was in practice, I treated adults, all of my adults, pretty much with aligners. So I had a lot of experience with aligners. But it was just the beginning of hearing about, aligners first. This was, I stopped practicing 10 years ago. So it was just kind of like beginning. So I didn't have a lot of experience with it. But you mentioned something about innovations and technological developments with this. So what tell me exactly, what is going on with aligners first? What are the things that you can do, and
Yes.
what's happening with them?
So Leon, it's actually pretty amazing. We like to say now we have the complete set of tools. We have everything from the Invisalign palatal expander, which we actually did the first round of trials on that almost over 5 years ago now. And so we've treated a lot of those patients. I don't know exactly where we are on numbers of patients, but in the hundreds with the Invisalign palatal expander. And now we also have the MA wings if we want to position the mandible forward. And we also have the occlusal blocks now. It's kind of like a twin block, but it's built onto the aligners. That appliance is amazing also. It's just been released earlier this year. And so we really have the complete set of tools. The Invisalign palatal expander now we'll be able to wear with a reverse pull face mask. So we pretty much have every set of tools that we would need to treat these growing kids. Aligners, coupling that with all the different appliances that we talked about, and a complete digital workflow from scanning all the way through to retention. And there's some really big things coming with direct printing and all those things that will be add even more options to us with these growing kids. So honestly, there's not a growing kid at this point with First that we feel like we can't treat. I mean, we can treat, if we can treat them with traditional appliances, we can treat them with aligners for sure with Invisalign First. So that's a big bold statement, but it's true.
So, do you think that traditionally, before there was digital media and digital marketing and everything, it was kind of word of mouth was the way that we heard about orthodontists in our area who were good and trustworthy. And now there are lots of different ways that we can promote orthodontic practices and build trust and gain awareness. But it doesn't mean that word of mouth isn't still happening, right? Like that's
Correct.
one component of the equation. It sounds like you do a lot of work educating and partnering with the pediatric dentist so that they understand the type of work that you're doing for their patients too, which is great. That's another way, of course, to attract patients. I'm always thinking of things from a marketing angle, of course, because People in Practice is a marketing company. Do you think in your area, are you one of the few that are implementing Invisalign First, or do you feel like this is a differentiator for your practice, something that makes you stand out among other orthodontists that are practicing in your area? And does it help you attract families to your practice?
Yeah, that's a great question, Amy, and absolutely it's a differentiator for us. We are one of the few practices that are treating growing kids with Invisalign First. And listen, parents, the best marketing is parents at the ball field, parents at school. That is the best marketing. And we have parents that come in and say, well, I talked to my best friend, her kid's 7, and she's wearing aligners already. And she told me I needed to get checked up with my kid to see if it's something that needs to happen. And so that word of mouth, absolutely. And that's why truly we take the time chairside to educate the parents and show them what we're doing, right? And show them the expansion of the arches, show them the development of the arches. And the cool thing too, I'm going to drop back on, I know we're talking about the marketing part, but we also do CBCT integration on these kids. And so we can actually see the bone before and after. We have before and after, and hopefully we'll be releasing a really good study at UAB, maybe in December or January. We should be finished with that. That is showing what actually happens with the development of these arches. And so we're able to promote that with the parents. And what's really surprised me is we're very aware of airway, but parents are super aware of airway now. There's a lot of stuff in the growing kids books and stuff the parents are looking at, talking about airway. And when we start developing these arches, we're definitely helping airways, right? The research, the data shows that if we expand and we make these arches what they need to be, it helps the airway. And so parents are super excited to talk about that. And so that's another differentiator that we feel like we can help them with this Invisalign First. And I truly believe we're just scratching the surface of this. And I think there will come a day where all parents will expect treatment to start at 7 or 8 years old, right? So that we're not removing teeth in the future and we're not maybe negatively affecting airways instead of positively affecting things. So those are some of the really, honestly, things I've had to wrap my head around because, again, I've been doing it for 32 years. And, a lot of the things that I thought maybe we couldn't do, we are doing. And we're doing it very safely and we're doing it with great results and, have the data to show it. So,
yeah. So, Don, Amy and I, we're marketers, right? So we're always looking at the marketing angle of it. So, as an orthodontist, I wear that hat. So I'm going to take that hat off right now, and I'm putting my marketing hat on. And one of the things that I do at People in Practice is I meet with our clients and I go over their KPIs. I go over their numbers. We're data driven, so we need to know what's going on in the practice. And one of the surprising things that I found that most orthodontists are not aware of is what happens when you put a patient into observation and recall. Like, how many of them actually come out? And how many do we actually lose? And, Amy is a mom. She identified the crowding in Kayla's mouth, not me. And moms are very aware of problems that are developing, and they want it fixed. And
absolutely.
I'm not here to convince any orthodontist to change their philosophy or how to treat patients. But as a marketer, I can tell you that when you put a patient on recall, that you're going to lose a significant number of them to your competitors over time. Moms don't want to wait years until all the permanent teeth come in. They just don't. They see other people at the bus stop, other moms, other kids in the class that are being treated, and their kid has crooked teeth. They don't like it. They want something done. That's why they came to your office. And if you're not doing it, unfortunately, somebody else is going to do it. So, from a marketing standpoint, Your philosophy is your philosophy, but my job is to point out what it's costing you in dollars. And, the number of observations that come out are not equal to the ones that go in. And, this is the dynamics of what's going on. So having said that, getting off my speech.
Your soapbox,
My soapbox.
Business development soapbox.
Yeah, exactly. I before we go, because I see time's running out, I do want to ask you this question. Things are happening so quickly, right? The technology is developing so rapidly. I want to know from you what you think things are going to look like 5 or 10 years down the road. And what should we be doing as orthodontists to prepare ourselves for what's coming down the line?
Yeah, Leon, I think definitely it's all going to be digital. And just think about the teenagers and the kids that are early 20 years old or so that we're treating with aligners now. And then they have kids. They're not going to come to your practice asking for braces most of the time. And they're not going to come asking for a metal expander or a Herbst appliance or all those things. When I can show a mom, here's the traditional expander and here's the Invisalign palatal expander, and 100% of the time they will choose that removable expander. So I do think in 2030, it's all going to be digital. How AI will affect a lot of this stuff, who knows, right? I'm not worried about that. I think that's just another tool that maybe helps me get to a decision faster instead of taking me longer to get to a certain treatment decision or a diagnostic decision. So I think there's two different sides of that. I really do believe, going forward, if you're not treating patients while they're growing, I think you're not going to have that pool of patients to choose from later, because people like us, and the side of that is why make a kid go from 7 years old to 12 years old with severe overjet and feeling bad about how things look, right? You can't buy self-esteem. They develop that, and you can't go back. So we see it as an opportunity to change how they're growing, change their self-esteem, and truly change their life, right? Better than we could ever do it before. So I think 2030, maybe all kids are getting treated at 7 years old. Maybe, there's no two-phase treatment stuff. We just get in, correct some stuff here, and the two-phase term just goes out the window, and we just talk about orthopedic orthodontics, where we get in, we change the bone, we let the teeth come in later, and we go back and line what we need to line. Mm-hmm. The amazing thing is some of these kids, we treat them early, we get the bone right, the teeth come in, they hardly need any treatment in the next part. So, that's going to be a learning curve from us too, as from an orthodontic. Let's talk about, you talked about marketing, and, how do you charge for that? How do we're not doing two phases of treatment. We're fixing the big things in the first phase. And it's an orthopedic change. It's not just an orthodontic change. So how do you charge for that? What's that look like 10 years from now? So I think we have a lot of things that we'll be wrestling with, maybe from a business model. But I do believe that, and we're seeing it in our practice, more and more moms. I mean, we have, honestly, a hard time a lot of times fitting in these 5, 6, 7-year-olds because the dentists are on board. They see there's an airway problem or, a crowding problem or crossbite issue. So we're already seeing that change in our office and working towards how do we handle that. And so I think it's exciting,
It is, and we'll want to follow you in your practice and have you back to be able to tell us how you're dealing with these changes from a business model perspective, from a clinical perspective, from an education perspective, and we really appreciate you being here today. If our listeners would like to reach out with any questions, is there a good way that they could reach out to you?
Sure. You can email me at don@drspillers.com. don@drspillers.com.
Perfect. Well, thanks
Might
very
take me
much
a little bit to
again.
get back to you, but I will.
Yeah, well, you're a busy guy. We know. We've heard. You have a lot going on.
So,
Well, we
yes.
very much appreciate your time today and look forward to having you back on the show.
Thank you for having me.
Thanks, Don.
You can subscribe or download other episodes of the Golden Age of Orthodontics or Practice Talk on Apple Podcasts, Spotify, SoundCloud, YouTube, if you want to see our faces, or wherever you get your podcasts. And if you enjoyed it, we'd appreciate it if you would tell a colleague. For more information about PPL, People in Practice, you can visit our website at pplpractice.com. For more information about People in Practice, visit our website, pplpractice.com.
And if you have a question for me, you can reach out at leon@pplpractice.com. You're hearing a lot about digital. It's a digital world. We talk about it almost on every podcast. Our sponsors are digital, KLON and Grin. And if you want a special deal, you know where to go, pplpractice.com, our partner page. So thanks for listening. Thanks, Don. And finally, remember, for forward-thinking orthodontists, it has never been a better time to be an orthodontist. We are in the golden age, so take advantage of it. See you next time. Bye.
Thank you for tuning in to the Golden Age of Orthodontics. Subscribe now on Apple Podcasts, Spotify, or visit our website at thegoldenageoforthodontics.com for direct links to both the audio and video versions of this episode.